This question comes in from El Paso, Texas, and it's a woman that says, I don't have any drive or motivation to do anything. Before the lockdown, I felt really engaged at work, and now I'm struggling to even get out of bed, and I'm no longer working. This sounds like a lot of people out there, right? I keep hearing about anxiety being debilitating, but I'm nervous that there might be something else wrong. I don't feel like I want to hurt myself, but I also don't know how I'm going to pay my bills. Am I just really anxious, or am I dealing with depression? Wow, this is a big question. A lot of people are in the same place as this woman. What's your great advice?
I think a lot of people want to know, well, am I depressed or am I anxious? I just don't feel right. What's going on? And usually depression and anxiety are, they're mixed, and there's like mixed state. You could be depressed and anxious. As a matter of fact, as people are treated, they come out of depressions, they have a lot of anxiety. So what are we thinking about? If we know clinically, if we see you depressed, you have dysphoria, no pleasure in life. You can't have any fun, and you have a negative mood, a dysphoric mood. So you have to have that. And it has to happen over a period of time, not just a day or so. But we'd say from 7 days, more to a month, that you're just having those cardinal symptoms I just talked about. Then what we talk about is my famous mnemonic that we all know about, Siggy caps. Now, Siggy caps, first the mnemonic is the S, that you find yourself, you're not sleeping. Okay, so that's number one. You'll see that in depression too, in anxiety too, as a matter of fact, because you have a change in your arousal states. So you can't sleep, you have no pleasure in life. That's really important, no fun in life. You're indifferent. You worry all the time. You feel guilty, or you worry about everything. You catastrophize, you worry about things. You have no energy. You feel really tired. You can't get yourself around. You can't concentrate. And you have psychomotor retardation. And lastly, but not least, you can become suicidal. Just think life's not worth living. Okay,
so like I said, so many people are dealing with unemployment right now, which would lead to, obviously, depression or anxiety. Do I need to self-diagnose myself, or should I just say I'm just not doing well? Should I give myself that? I mean, obviously, people are going through a bad time. Don't give yourself a hard time.
When do we really seek treatment for depression? Depression is also a neurological function. Our neurochemistry changes, and we develop what's called like tunnel vision. We can't see options. When you want to work through a problem, you can't positively talk to yourself. You can't say, well, I'll get a job. I always did. I always got jobs. There's going to be jobs around. But you can't think like that at all. Everything is tunnel vision, doom and gloom, and you don't make good decisions. So cognitively, you're really impaired. And if your friends and family, and yourself, you see yourself, you just have tunnel vision. You can't see any of the options, then seek some professional help.
So I'm thinking, though, obviously, you have to be of strong mind and body to get yourself out of a hole, right?
Yes.
Tell us about what type of talking can I do for myself? What can I be telling myself to be giving me positivity, confidence, to get out of that bed, right? To start washing my face, to start feeling good about myself, so that when this is all over, I can go and hit the pavement and get myself employed again. How do you get the gumption to do that?
Well, look, I think there's a lot of ways that humans have developed good skills and habits to care for ourselves. I mean, if we're in a good routine and we're trying to get good nutrition and exercise, we're doing all the things that we can do to right ourselves. And we're talking to our friends, we're doing everything, but nothing seems to work. The way you used to solve your problems, you used to talk to yourself. give yourself, or go to church or temple, wherever you go, and all these things would make you
Right.
positive.
Give yourself a
feel
pep
good.
talk.
Yes, a pep talk. Now, people who start to get depressed, there's no pep talk. All gloom and doom, usually bad things. You ruminate about bad things and you can't function. Your self-care skills, start to diminish. Your relationships diminish. Then, it might be time to get some professional help.
Okay, so professional help if you feel that you just cannot get out of that rut.
By yourself. Now, I've had patients that have come to me recently that with this description, and what I have done with them, they would say, well, I used to be on some medicine, serotonin reuptake blocker and antidepressant. Do you think I should take that again? I
Right,
had
like
one
a Prozac.
lady, Prozac or Zoloft. She says, yeah, I used to take Zoloft. And did it help? I said, yes, it helped. So I put her on some Zoloft, and like a miracle, 4 or 5 days, I called her back. She was doing better, self-talking to herself, and still today, after several weeks, getting better all the time. I've adjusted her dosage. So really, there's a chemical change, too, that happens in depression. So people, if they feel the way we've been describing, then maybe it's time to go seek some professional help.
Right. So I guess there's always light at the end of the tunnel, and seek professional help if you feel that there's no other way. So great advice as always, Dr. Bregman, and I hope to talk to you soon.
Terrific.
BregmanMD Medical Group offers online psychiatry and online therapy.